Ladies and gentlemen, welcome to the second part of the webinar series where we discuss the framework outlined in Closing the Gender Nutrition Gap, an action agenda for women and girls. This action agenda is more than a mere document. It is a call for collective action to accelerate progress and achieve shared goals across critical domains. We implore actors globally to reposition nutrition as a feminist issue. For advocates committed to advancing women's and girls' nutrition, the action agenda provides not only policy recommendations and evidence-based justifications, but also strategic guidance to shape national or regional advocacy strategies. These strategies are tailored to local contexts, needs, and opportunities. We hope the action agenda is a tool for advocates to form coalitions to help shape and define specific advocacy strategies at the national or even regional levels. It is a vehicle for change, providing the means to advance priorities with policymakers and decision makers to ensure actualized outcomes. Thank you all for joining us from all over the world. There is interpretation in French and Spanish available. Do click on the globe icon and you'll be able to access this service. Ladies and gentlemen, the government of Switzerland was the donor of Sun CSN at a global level. They're also a donor of FHI 360 as well as Alive and Thrive. The next steps of the action agenda would not be possible without the financial support from the Swiss Development Corporation. We thank the SDC for enabling the follow-up learning visit on closing the gender nutrition gap of the Sun Movement delegates to Vietnam in January. With that, please welcome Isabel Wiss, Program Manager in the Health Section, responsible for health determinants for the Swiss Development Corporation, for her opening remarks. Isabel.
Merci beaucoup. Bon après-midi, good evening. My name is Isabel Wies, and I'm joining you today from our headquarters in Switzerland. It's my absolute pleasure to open this webinar. And I work for our health team responsible for health determinants. I'm here with my colleague, though, also from our food systems teams, as we try to tackle the issue of nutrition with a multi-sectoral approach, meaning that we collaborate on nutrition projects with colleagues from different teams like health and food systems, for example, but also others like gender, migration, and economic development. And for us, this collaboration is crucial to tackle what we heard in the last seminar, at the same time, very simple yet very complex issue of the gender gap in nutrition. The gender gap in nutrition is a driver of inequity in relation to all health determinants. For example, the Special Rapporteur on Health for the UN examined how the lack of access to safe and nutritious food has an impact on growth, development, and quality of life across the whole life cycle. She also identified how increased consumption of unhealthy food and beverages has driven the burden of non-communicable diseases. The support of the most vulnerable girls and women is, of course, the absolute priority for SDC. Nevertheless, I think in Switzerland, in our own country, we also have to think about the gender gaps in all forms of malnutrition, particularly for us, overweight and obesity, which is the biggest risk factor for non-communicable diseases, which are a huge burden for our health system. We are very proud to be part of the Sun Donor Network and to support the Sun Civil Society Network, as for us, the civil society is really crucial in providing an effective and targeted response to the gender gap in nutrition. And the civil society is equally very important to advocate for the most vulnerable, of which women and girls, unfortunately, are overrepresented. Community and national action is crucial, and I'm therefore looking forward to hear so many concrete examples today. However, it must at the same time be connected with global advocacy, and it's therefore great that this action agenda brings together so many different stakeholders to connect the local experiences with the global, so local. As a government, we also have a responsibility to shine a light on this gap, as it hinders the achievement of the SDGs in a number of ways, as we've heard, but especially also equality. An important factor of this is also to fight stereotypes and harmful social norms when it comes to nutrition. And we therefore have a focus on gender and gender-related specificities in all of our projects, be it health projects, nutrition projects, or any other projects that the SDC supports. We are committed to improve our understanding, first and foremost, of the gender nutrition gap and to implement in our projects what we've learned. I think myself, I have a lot to learn on the subjects, and I'm therefore looking forward to the many interesting expert inputs of today. And I would like to close my remarks by thanking wholeheartedly the organizers of today, and we hope that we can all take something away for our continuous work on this issue. Thank you very much.
Thank you very much, Isabel. And now just to move on, to give us an overview of how advocates and policymakers can use the action agenda as a resource to advance women's and girls' equal rights through optimal nutrition. Please welcome Dr. Deborah Ash, Senior Nutrition Advisor, Global Nutrition from FHI 360. Dr. Deborah.
Yes, thank you very much, Mira. And good morning, good afternoon, good evening to all of you who are participating in today's webinar, the second one in the series. We're thankful to see that many have joined both of these webinars, and there will be a bit of repetition from the first webinar, at least to set some of the context for this one, where we're going to have an exciting opportunity to hear about how we're actually using the action agenda. And as we've heard already from the introduction, the embarking on putting together a global action agenda like this was very much driven by the end goal of wanting to make sure that this is going to be something that would be a resource and build on commitments that are already in place. And so we'll have a chance today to hear more about that. So just to set a bit of the context here, may I have the first slide, please, where we have presented last week more of the details around the co-creation process and who has been involved in this. And for today, we'd like to focus on how do we actually use this action agenda. And we hope you've had a chance to look at this. If one of my colleagues from FHI 360, Kristen, if possible, if you could put in again the links to the Gender Nutrition Gap website, as well as the link to the actual PDF file of the action agenda. What we're going to be looking at here is how is this structured? And we know that we've shared with you last week that this is a result of a successful co-creation. And we're very excited that we've brought this forward with more than 40 organizations, and that's a growing number because, as we've emphasized, this is very much about a coalition moving forward and our collective action and commitments to closing this gender nutrition gap. And so in the document, from the very beginning, we wanted to be very principle-based. And you will see in the document that we did outline 10 principles for actions. And because in the interest of time and hearing from our speakers who've been able to work with this document, we won't be going into all the details, but we do encourage you to have a close look at the action agenda. And you'll see those 10 principles for actions in there, as well as the 4 action areas. And the way that we went about the co-creation process in the consultations and the review of the literature and all of the operations, look at how this works programmatically, as well as opinion leaders research, we landed on 4 action areas. And so in the next slide, you'll see the partners who have already co-branded this action agenda. We expect that we'll be adding more. This is not representative of all that have joined at this point. We have a rolling group of partners that are joining into this. But as you can see, it's spanning nutrition, it's spanning gender, it's spanning health, as well as you can see here some of the medical professional associations, which are very important, discerning and influential voices, particularly in India. The India Academy of Pediatrics, including their women's wing, has joined into this. So you can see that we're really going for a very broad ownership and use of this action agenda and getting out of as the nutrition silo, as we often speak about. And in the next slide, the framework for action itself, we know that when we embarked on this, we were entering into a very broad scope of action, and we had to find a way to define this and make it so that we would come out the other side of this process with a blueprint for achievable solutions and be very focused on achievable solutions. And so we landed on 4 key action areas: healthy diets, care, and by care, we mean both the health system as well as the social protection system. Gender equality as a very important center of this, and the gender transformative lens being applied across this action agenda. And then action area 4, around the importance of strengthening the multi-sectoral policy environment to support the improvements in women's and girls' nutrition. And we are happy to see that we have been able to mobilize a number of actors, and you'll hear about how this is going to be even a focus for the upcoming N4G, Nutrition for Growth process and commitment making. And we are also happy to see that we've been able to build on this repositioning nutrition as a feminist issue and building on the very important work that's been going on across multiple domains to really focus on many of the gender gaps that we are contending with. And one important note I'd like to make is that in these action areas, it's not only about policy, it's also focused on the practice and changing of behaviors. And as we've heard, these important social determinants like the social norms and paying attention to multiple levels of action that needs to take place. Next slide, please. And so very briefly, there is actually a section in the action agenda that describes how to use the action agenda with some suggested ways of picking up this action agenda and working with it. You'll see that we've added an executive summary into the action agenda to make it easy, especially to discuss with groups that are coming on board. And it's an opportunity to really summarize what's in this action agenda. And the way we've set out the framework for action, this is really the heart of the action agenda. You'll see it covers multiple pages in the action agenda. In each of the action areas, we have laid out a framework for action, and we have 3 simple columns that are easy to absorb this information, where we have in the first column, why it matters. Why is the specific action important? What is the rationale and importance of that? And then in the middle column, you'll see in that framework are the example commitments. So we've actually written out some example commitments based on evidence, based on already action that is in place. And the third column, we've called out the actors. And you'll see that the format is relatively easy to follow with a rich detail. And as we have talked about in the last seminar, we had the opportunity to work with subject matter experts across a realm of areas, and we were able to seek their advice on what is the most important critical action to take in these different action areas. And we had suggestions by reviewers that in order to make this really very tangible, that it would be important to add case studies to make it real, so that it wasn't a lofty, only intangible action agenda, but backed by case studies. So you'll see in the action agenda several case studies that are provided on the linkages of why are we calling out the various linkages between, say, care and girls and women's nutrition, healthy diets, the importance of that for girls and women's nutrition, and particularly in gender equality, all the important fundamental work on rights of girls and women that very much weighs into the state of girls and women's nutrition. So you'll see there's some very practical case studies from multiple countries. And then finally, there's a piece in there where we work together, again, co-created across a number of partners, to really elaborate on a definition, because one of the things that we encountered at the very beginning was that this was a clearly an area that attracted a lot of concern and attention, but that there was fragmented information and a direct call out from the Emergency Nutrition Network in their very important report on women's nutrition, that in order to understand what's going on with women's nutrition, one has to seek this from many different places. There are different ways of expressing it. So what we did is we co-created a summary and full definition of what do we mean by girls and women's nutrition. So you'll find that in the action agenda. We've heard from partners that this has been very helpful for their communications and for their further understanding and case for further action. And then now to talk about some of the 8 actions that have been uplifted. So I mentioned that we have the executive summary. And then what we did was we uplifted 8 key actions to close the gender nutrition gap. And you'll see here 4 on the screen. The first one being around maternal, newborn, and child health. And we made a very specific call out to double down on high impact, cost-effective nutrition interventions within MNCH services and antenatal and postnatal care platforms. So you'll see in the write-up and the framework for action, the specificity around that. And we're writing these from a perspective of making smart commitments and smart objectives that would be adapted according to the context. And you'll hear from colleagues in different countries on how they went about making those adaptations and how they influenced the writing of this global action agenda at the same time. So a very important call out to the ongoing commitments in maternal, newborn, and child health and the impact that those have on girls and women's nutrition. The next one here, you'll see integration of care. There's a very strong call out about strengthening the linkages across the care system, and even talking about the unpaid care economy and how that features in to the disproportionate impact of malnutrition on girls and women's nutrition. And you'll see here a strong call out again on the social norms that we all want to commit to enact gender transformative policies and programs to address root causes of gender inequalities. And so you'll see that the action agenda is very much about those root causes, not just a list of exactly what interventions to do, but also considering the underlying determinants in a very important and serious way of how can we move some of those social norms to be able to improve girls' and women's nutrition. There's also a specific call out to market failures and the importance of educating on the importance of healthy diets and protecting consumers from predatory marketing practices, and with very specific legal language in there about how to go about that, with examples from countries that have been successful in doing this. So again, leading very much by examples to motivate. Next slide, please. And the next 4 out of these 8 policy actions that we've called out, you'll see the section in the action agenda where it simplifies this. We've made a very specific call out to social protection, and we do have a colleague panelist from WFP on the call today, and we'll be speaking more about the importance of social protection, expanding functions of social protection systems, and how these are working or not working, and optimizing these for nutrition and women's and girls' economic empowerment. And very importantly, having a specific call out to the humanitarian response that we need to see in prioritizing women and girls' nutrition in humanitarian responses. So you'll see in the action agenda some very specific language on example commitments and why this matters and who are key actors to make this happen. And as I've already alluded to here, the unpaid care economy, we made a very specific call out to account for the immense value of the unpaid care economy, which we know is largely carried out by women, and that we also know does not appear in a systematic way in national planning frameworks, but yet is a very, very important consideration for the overall economy. And there's specific language in there as well as links to resources. And as we mentioned last week, on the campaign website, you'll see a number of resources that are available there to refer to. And then finally here, the importance of accountability. And you'll see there's a very specific section in the action agenda that calls out the importance of doubling down on these vast data gaps that we know about. And as we heard about from Emily Mates and the UNICEF team last week, that was very much featured in the overlooked and undernourished report on girls and women's nutrition. We do have vast data gaps on women and girls' nutrition, and there is an importance to invest in data systems and routinely and regularly collecting this data. So again, in the action agenda, there's very specific language to help with wording these kind of commitments and moving forward action. And again, very much emphasizing the importance of adaptation and contextualizing this. And the speakers today will tell us more about their action on this. Thank you.
Thank you, Deborah. And so that was an overview of the action agenda. And I think there's been some requests about sharing the links. You will receive the links and some of the materials in your emails. So just bear with us. After the webinar, the organizers will organize that for you. Now allow me to welcome Kristen Kappes. She's the Associate Director, Programs of Global Nutrition at FHI 360, and she joins us to share her experience applying the action agenda from a country approach in India, Nigeria, and the East Asia Pacific region. Kristen?
Thanks. Good morning, good evening to everyone. Next slide, please. A defining feature of the action agenda is that it is intended to be used as a practical resource, which we heard from Deborah. It's not a theoretical document. It's really a resource for advocates, policymakers, and decision makers across sectors to guide how they can take action for women's and girls' nutrition at multiple levels. Today, I will be sharing with you examples that illustrate how the action agenda has been used as a practical tool at the country level to guide decisions around what coalitions should focus on to advance women's and girls' nutrition based on their country's specific policy environment, political will, needs, opportunities, and challenges. These examples come from India, Nigeria, and the East Asia Pacific region and illustrate how the global action agenda framing, narrative, and calls to action to establish a common policy agenda that united stakeholders across sectors to take collective action to accelerate progress toward shared goals across the nutrition, gender, and MNCH spaces. Next slide, please. We use the action agenda in 3 geographies where our organization, FHI 360, had field teams working on the global initiative Alive and Thrive. Our work in the East Asia Pacific region was upstream in the sense where we worked with regional platforms using the action agenda as a guide to provide technical inputs into regional minimum standards and facilitate their alignment with calls to action in the action agenda. So in that sense, it was really a resource to guide how can we look at documents that are being drafted to make sure that they are really calling out women's and girls' nutrition. What do we need to include in them? My presentation today will focus more on our downstream work in India and Nigeria, which focus on advocating for women's and girls' nutrition with national governments and development partners. And our approach really started with the selection of the right local partners with deep advocacy experience and relationships who worked hand in hand with our Alive and Thrive staff on the ground, which was the Civil Society for Scaling Up Nutrition in Nigeria, CSN, and Global Health Strategies in India. So I'm really presenting the work today on behalf of them, our Alive and Thrive colleagues, and many other staff from various organizations who contributed to this work. First, after we mobilized our teams, we conducted formative research, and this really underpinned the work. We conducted stakeholder mapping that categorized stakeholders' influence and interest on the issue of women's and girls' nutrition. We conducted policy reviews to yield insights on the national policies, programs, and strategies across relevant sectors to women's and girls' nutrition. And we conducted opinion leader research to gain insights on the opportunities to advocate for women's and girls' nutrition. And together, this formative research really surfaced what are the current opportunities to advocate for women's and girls' nutrition and the main barriers to change. Once we had completed the formative research to really understand the situation, the context, and the opportunities, we convened workshops to develop advocacy strategies that charted out advocacy goals and objectives to make inroads for women's and girls' nutrition. We also supported the process to develop joint plans of action with various coalition partners that specified the activities, the materials, the lead agency, expected change, and means of verification and timeline to implement the advocacy strategies. Our process from start to finish was really focused on collaboration, coalition building, and co-creation, really being joint processes across many organizations working on a shared interest to improve women's and girls' nutrition. Next slide. So what did this look like in practice? I'll share an example from Nigeria. Based on our stakeholder mapping, we mobilized a coalition of various academic and research institutions, government, UN agencies, local organizations, and INGOs. And this coalition came together and they reviewed the 4 action areas in the action agenda that Deborah presented: healthy diets, care, gender equality, and multi-system enabling environment. And based on our formative research and the discussions by the coalition, they decided that their strategy for women's and girls' nutrition in Nigeria really needed to focus on gender equality. There was a strong resonance that gender equality was a prerequisite to achieving nutrition goals. And without it, women would not be able to provide healthy diets for themselves, their families, their communities, or be able to access health and nutrition services equitably. And they were able to achieve tremendous progress and momentum in a short amount of time. Women's and girls' nutrition was a relatively new topic in Nigeria. There had been considerable work in maternal nutrition and infant and young child nutrition, but really looking at women's nutrition across the life cycle hadn't been prioritized yet. We were able to secure commitment of the Federal Ministry of Women's Affairs to lead 8 ministries to develop a women's and girls' nutrition guideline. And this is just an example of really the tremendous progress that the Nigeria team was able to take the action agenda, use it as a guide to craft a national advocacy strategy, and real progress that was made through those efforts. We also implemented a number of advocacy activities, including media roundtables, town halls, and social media engagement to raise the profile on the urgency of the issue and coalesce stakeholders on discrete advocacy asks. Next slide, please. This slide shows the resulting advocacy strategy that this coalition in Nigeria built. Again, this was focused on gender equality. Their goal was to empower women and girls for optimal nutrition, and their objectives were focused on developing a national guideline on women's and girls' empowerment for optimal nutrition, increasing the number of women in decision-making positions, increasing gender equity and the access and utilization of public economic empowerment schemes, increasing awareness of professionals at the federal level to become champions on girls' education, and empowering women in the workplace and empowering private sector to adopt policies that remove barriers for women in accessing paid employment. And this is really just to show that how to take the action agenda. This coalition in Nigeria reviewed the 4 action areas, and they decided to focus on gender equality based on the formative research, the context, the opportunities, the challenges, to really think about how they can advance women's and girls' nutrition in a meaningful way in their specific context. Next slide, please. Another example from our country work in India. Again, this was done with our FHI 360 Alive and Thrive colleagues and global health strategies. First, again, based on our stakeholder mapping, we mobilized a coalition of government, donors, INGOs, UN agencies, and local organizations who have both shared interest and influence to advance women's and girls' nutrition. In India, the group came together and similarly reviewed the 4 action areas. and decided to focus on the fourth action area on multi-sectoral enabling environment, and really felt that there needed an explicit focus on sensitization. And their strategy focused on multi-sectoral coherence and convergence in policy and program implementation, and specifically girls' education as a key area for advancing women's and girls' nutrition in India. We also engaged state-level influentials in Uttar Pradesh for how they, in their various professional roles in government, in community organizations, in research organizations, can advance women's and girls' nutrition. The stakeholder mapping workshop had really fast-tracked and surfaced a unique and far-reaching political opportunity in India to elevate the issue of women's and girls' nutrition and gender as an emergent policy dialogue at the onset of India's presidency of the G20, which took place several months back. Ultimately, the G20 New Delhi Leaders Declaration, which was adopted at the end of the G20 summit back in September, had stated commitment toward making women's food security and nutrition a cornerstone of individual and community development, as well as positioning women's nutrition using a gender lens based on committed action from the coalition, which was really encouraging to see. Other advocacy wins during the coalition building and advocacy strategy development process was the endorsement of the action agenda by the Federation of Obstetric and Gynecological Societies of India, who is a leading voice in the country, influencing policies and programs that affect women's nutrition, as well as the endorsement of the action agenda by the Indian Academy of Pediatrics and its Women's Wing, who are leading discerning voices for influencing nutrition policies, programs, and practice in India. Next slide, please. This is the resulting strategy that, again, the India Coalition, in using the action agenda as a resource, was able to craft their advocacy strategy. Highlights from the strategy include a focus on advocating for comprehensive program guidance on women's and girls' nutrition from 3 ministries, advocating for optimizing missed opportunities in existing government programs and budgets for women's and girls' nutrition, engaging the private sector for increasing investments in women's and girls' nutrition through corporate social responsibility initiatives with an explicit focus on gender and nutrition, and aligning and leveraging the national education policy for promoting education of girls. Next slide, please. This slide is just showing that we did feature this country of work in the launch of the action agenda, which was done at the Women Deliver conference in July 2023 in Kigali. We had a 90-minute concurrent session with UNICEF, Africa Leaders for Nutrition, the Micronutrient Forum, and Gender Health, and the Bill and Melinda Gates Foundation. It included opening remarks, video remarks by the First Lady of Ghana. Previous slide, please. And really positioned nutrition as a feminist issue and called for urgent collective action to close the gender nutrition gap. And the Women Deliver conference organizers in their external communications had cited the launch of the action agenda as one of the top highlights and outcomes from the conference. So just another forum where we have shared country work from our India and Nigeria teams. Next slide, please. We had several lessons that we wanted to share for uptake in new geographies. Again, we really hope that the action agenda will be used at the country level, at the regional level, to guide how women's and girls' nutrition can accelerate progress on it. And these are some of the lessons that we found. First, in both India and Nigeria, we really found that the environment was ripe for women's and girls' nutrition because there had been considerable progress in maternal nutrition and overall technical know-how for how women's and girls' nutrition can be transformative for moving the agenda. So this provided really fertile ground for expanding a focus on women's and girls' nutrition across the life cycle. We also found a need for a more intensified approach to bring in more MNCH and gender groups into coalitions. We found that nutrition groups were ready to join, and finding groups engaged in climate change, for example, we had to be more deliberate on including them, which is really important to having a multi-sectoral lens to using the action agenda. We wanted to underscore the importance of formative research to underpin the adaptation of the action agenda. If you are going to use the action agenda in a country where you hail from and where you are working, conducting formative research to really understand what the context is, where the advocacy opportunities lie, what are the barriers, is essential for successfully using the action agenda. Having a long-term vision, needing to be successful for the coalition to really understand what they are working towards. And we also found, while a lot of our work was looking at kind of national level policies and programs, we do recognize that to really truly advance women's and girls' nutrition, there needs to be bottom-up approaches to looking at how to create change at the community level. And in conclusion, just wanted to underscore that the presentation today, my remarks really focused on how India and Nigeria were able to successfully use the Global Action Agenda, framing, narrative, and calls to action to guide decisions around what they should focus on at the country level to advance women's and girls' nutrition based on each country's policy environment, political will, needs, opportunities, and challenges. We do have Sunday from CS Sun and Rodi from Engender Health as part of our panel later, who have been involved in these processes. So just want to direct you to them as well as excellent resources to learn more about this. Thank you.
Thank you very much, Kristen. And before we move to the panel discussion, we invite Soliana Marza. She's the Interim Initiative Director, 1000 Days Initiative from FHI 360, to brief us on the global advocacy ambition moving forward. Soliana is unable to join us live, so here's a pre-recording of her presentation.
And I'm the Interim Initiative Director of 1000 Days. 1000 Days is an initiative of FHI 360 focused on making the health and well-being of families in their first 1000 days a policy and funding priority. Thank you for joining this two-part series on closing the gender nutrition gap. Before we end our closing panel, we wanted to share just a little bit more on our global advocacy ambition for this co-created agenda and campaign. You just heard from Kristen on a few country-led examples of how the action agenda can provide a guideline to integrate women and girls' nutrition into policy and funding decisions. These examples capture the essence of the agenda and show how the agenda can be translated to meet specific country contexts and needs. Our global advocacy ambition is about addressing immediate challenges, and it's about building a sustainable legacy. We envision a future where the gender nutrition gap is not just closed, but obliterated, ensuring the health and well-being of women and children worldwide. The Action Agenda is a resource for global, local, and national levels, as well as across sectors, demonstrating how integrating gender and nutrition lifts all boats and advances shared development goals. This is not meant to be a static document. We continue to build out our policy priorities and coalition of partners and strongly invite all of you to join us. Our ambition is to see the Gender Nutrition Gap campaign used on its own, but more importantly, to also see the priorities laid out in the action agenda reinforced in partners' advocacy and programming. An upcoming opportunity to leverage this agenda is at the upcoming Nutrition for Growth Summit. Nutrition for Growth is a global effort to bring together country governments, donors and philanthropies, businesses, civil society, and beyond to unlock the power of good nutrition. We unlock this power by adopting stronger evidence-based policies at global, regional, and country levels, pledging to increase financing for proven nutrition-specific and sensitive interventions, and committing to aligned and harmonized actions across sectors and stakeholders. The 2021 N4G Summit was hosted by the government of Japan and resulted in over $27 billion pledged to nutrition and almost 400 new commitments. All reporting and progress made on implementing these N4G commitments is tracked by the Nutrition Accountability Framework, or NAF. This success would have not been possible without the collective efforts of champions across levels, encouraging and supporting decision makers to articulate ambitious yet realistic commitments. And it is our ambition that this upcoming summit leverage this collective body of work, leverage this Women's Nutrition Action Agenda and Gender Nutrition Gap campaign to frame the summit. The next edition of N4G is in 2024, maybe early 2025, and will be graciously hosted by the government of France. Our advocacy roadmap looks a little like this. We're looking to grow gender nutrition gap partnerships by expanding our list of gap closers beyond the nutrition silo. As we were creating this agenda and campaign over the last 2 years, we worked diligently across sectors to include gender experts, maternal and child health experts, advocates, policymakers, and more to ensure that we are creating something from a collective voice that can be utilized by many. We're continuing to shape the dialogue around women's and girls' nutrition and the intersections between sectors through webinars like this one, our coalition, Nutrition for Growth partnerships, and other upcoming events. We're hoping to build awareness and support for women and girls' nutrition linkages to other key sectors. Over the next 6 months, we'll be focused on working with partners to develop practical advocacy tools that support gender transformative commitment making across global, regional, and country levels based on the Women's Nutrition Action Agenda, all in hopes to mobilize gender transformative nutrition for growth commitments with strong accountability mechanisms in place to track impact. So post N4G, when we're trying to kind of track and measure success, we have to have a clear vision of what that looks like. For us, success looks like smart, ambitious commitments were made to take trackable and measurable action on a prioritized package for women and girls' nutrition by donors, countries, development banks, and other civil society partners. Commitments address critical needs across both development and humanitarian contexts. Commitment makers were able to articulate and track funding envelopes directed at women and girls specifically. Commitments were designed with a strong gender transformative lens. Financing and policy commitments were made by new donors, countries, and civil society organizations that reaffirm the linkages between women and girls' nutrition and other social sector outcomes and opportunities for greater program impact and efficiency through better integration. There were strong mutual accountability mechanisms implemented and used to ensure follow-through on all commitments, meaning that the NAF took on a strong gender transformative lens in tracking commitments, and that the summit itself would help the nutrition community engage the broader development community and humanitarian community and position nutrition as a critical foundation for achieving and advancing shared goals. We can't do this in silos, and we can't do this alone. Together, we can close the gender nutrition gap. Please join us. You can join us at gendernutritiongap.org. Thank you.
Thank you very much, Soliana. And now to delve further into the use of the action agenda at regional and national levels, three very knowledgeable, experienced, accomplished individuals join me. Please welcome Juan Gonzalo, Social Protection Program and Policy Officer at World Food Program. Juan, are you there?
Yes, I'm here. Thank you very much. Very pleased to be joining you today from Timor-Leste. And okay, so I'm going to tell you a little bit about how we're using the action agenda in the World Food Program. And I want to just say how happy we are and to be part of this as part of WFP as well, on how are we using this action agenda and closing the gender nutrition gap. So
thank you.
The first thing that we are actively using the action agenda as a vital resource to advocate for multi-sectoral actions, particularly, but not only around social protection, to improve women and girls' nutrition. And we are playing a key role in three ways in the action agenda. When first providing expert advice, so WFP has provided with subject matter experts, a lot of input, has provided a lot of input and has helped shape this agenda. And the second one is that we've been working hard with this big team to amplify the messages that we have there. So WFP Advocacy and Communication teams co-created the Gender Nutrition Gap campaign, developing its positioning, narrative, and communication strategy. They also provided in-depth content review for action areas 2 and 3 on gender equality. We finally have also been helping to drive global commitments, such as the last panelist mentioned, the Nutrition for Growth. We have been actively engaging the roadmap for the N4G working group, accelerating collective commitments to girls and women's nutrition to the lead up to the Nutrition for Growth Summit. So that brings us to the second question. How is it that what is it that WFP is advocating? If we're going and supporting with subject matter experts, amplifying the message, being part of critical fora as the N4G, what are we saying? So what we're saying is three things, or three basic considerations. First, let's put and prioritize women's and girls' needs. So social protection interventions, particularly social and food assistance programs targeting the poorest and most vulnerable, must specifically address and do not neglect, as it has in some places happened, the needs of women and girls who often experience multidimensional poverty more severely. The second point is that we're saying let's tackle the risks, the life cycle risks. So we're advocating for recognizing and addressing the specific risks that women and girls face across different stages of their life cycle. For example, anemia in adolescent girls, where we see the interface between gender and age to ensure their optimal health and well-being. And if we're doing these things, colleagues, meeting needs and addressing risks, we are doing the third thing, which is quite important, which is breaking the intergenerational transmission of malnutrition, poverty, and vulnerability. So these includes preventing stunting and non-communicable diseases that result from low birth weight and impact of morbidity throughout life, and the recognition that malnutrition in this case, it's also a cause, but as well an exacerbating factor of poverty. So we are often, as the world's largest humanitarian organization, with work in supporting social protection programs that are led by government in 88 countries, we are asking governments to take three critical measures, and I'll give you some examples in a minute. But first, that we need to recognize the impact of social norms. First, social and gender norms often mediate in women's and girls inadequate access to the quantity and quality of nutritious foods they need. Government must acknowledge and address these norms. For example, I was here in Timor-Leste, and I was mentioning how is it that the food distribution happens at home, and what happens when you give the biggest piece of meat in the house, who would get it? And oftentimes it is at the neglect of adolescent girls who are the ones who will require more iron dense foods because they're giving to the male members of the family. So social norms in that inadequate access to food plays a key role, and we want to make that example and that evidence very clear. The second point is that we're saying let's support caregivers. Let's highlight the unequal burden of care carried by women and girls, which is often transmitted not just through gender lines, but by other social identity markers like age, ethnicity, race, class. Governments in that case must not only recognize and help represent caregivers, but reduce, redistribute, and reward them by the application of this 5R framework to achieve this SDG target number 5.4, where social protection is recognized as critical. And thirdly, what we're saying, let's address socioeconomic barriers. Social protection cannot do it alone, and needs quality of social services being extended. Women and girls face significant socioeconomic barriers to accessing essential social services like health and education, which we know are critical determinants for their nutritional status. So social protection can help structure demand for services and address these obstacles by supporting women's and girls' economic and material independence, but also to overcome opportunity costs. So this is basically how we utilize that agenda in the benefit of the messages that we're giving by WFP.
Great, thank you, Juan. We'll come back and have a discussion after we introduce Sunday Okoronko, Executive Secretary at the Civil Society Scaling Up Nutrition in Nigeria, CS-SUN. Sunday, are you there?
Yeah, I'm here. Good afternoon, everyone. It's really a privilege for us to share experience. Hi, Mira.
Hi, welcome back, Sunday. I mean, you were in our first webinar. Sunday, do you just want to quickly go through with us the work you've done at the CS-SUN in this area?
Okay. Thank you so much, Mira, and thanks everyone for finding the time to join us again for the second part of the webinar. I think for us in CS-SUN Nigeria, the Sun Civil Society in Nigeria, it was a real opportunity for us to be able to work with the FHI 360 team to domesticate, or I would say put in the context of our country, the action agenda for women. Because in Nigeria, there's really the need to bridge the gender nutrition gap in country. Because if you look at our statistics, we look at some of the challenges around malnutrition, women mostly, and even children, the vulnerable group, they are the main victims of this major challenge in country. And the action agenda presented us an opportunity to look at the action areas and also narrow it down to the one that is, we believe if you are able to address it, you would almost solve most of the challenges women face that, hinders and limits them to accessing optimal nutrition in the country. And had been presented at the meeting, you find that what we did is we contextualized the action agenda. We needed to come up with a national strategy. I call it national strategy because we try to carry almost most of the organizations and persons that has one thing or the other to contribute to making this work. And so there was a national workshop where we all agreed that there was a need for a strategy. And within that strategy, something stood out. There is a missing gap. How do you link up all the sectors that are working, that are in one way or the other supposed to contribute to improving women and girls' nutrition in the country? You can't talk about improving nutrition and not talk of health, not talk of the agri sector, not talk of the wash sector, not talk of, for example, gender empowerment, norms, beliefs that hinder women and girls from growing up to their potential. Permit me to use the word God-given potentials, and not limited by some of the beliefs in their communities, states. And so we all agree that there was a need for a national guideline on empowerment of women. That is to say, if women are empowered with quality education, women has access to, for example, ability to make decisions on their own, not having to, for example, wait for their husbands to make decisions around their health, around the kind of food they want to eat or they ought to prepare for their children or families and the rest of them. If they have that ability to make such decisions, they have the opportunity and ability to, to aspire and attain at the highest level of education for themselves. And also, they also assess some of the government approved empowerment program, access to loans for agriculture, access to land, and the rest of them. That if we have something that pulls these sectors together, different intervention from across sectors, and put it in a guideline that will be domiciled in one of the ministries now known as the Ministry of Women and Ministry of Women Affairs, and they playing that coordinating role such that we define how the process of these interventions across these sectors will happen, to promote synergy, to promote effective coordination, and also to promote the ability for these different stakeholders, speaking up for adequate funding from government, speaking up for example, and having access to the highest level of government, of opportunities in the country. If we have a document like that that will guide across sectors, I believe people will be guided to both implement these programs and activities that will improve nutrition in the country, especially among women and girls.
Okay,
and
thank
that's
you
how
very
we
much.
came to the
Sure.
Okay,
Thank you, Sunday. I'm going to pass the platform to Rodi Gangte, the Senior Manager Programs and Gender Health India. I mean, Rodi, you worked on comprehensive programs to mainstream gender in large-scale food fortification. Do you want to give us an overview of your program on how you mainstream large-scale food fortification?
Right. I'll first begin by saying that thank you very much, the Women's Nutrition FHI 360, for including gender health as a part of this very pertinent conversation. And also for the very comprehensive action agenda, which is not only gender responsive, but also very, I would say, a practical guidance for those who want to take up advocacy in different contexts. And Gender Health is a global organization working in the area of sexual reproductive health and rights and on gender equality. We currently work in 11 countries, including India. I will focus my talk on the project that we have right now, which is called Gender Mainstreaming in Large-Scale Food Fortification Program. Though in short, LSFF. Though the focus will be on LSFF, but I like to say that gender, I like to give it, embed into the larger picture of gender in nutrition and not just focusing on LSFF, because large-scale food fortification program is a part of a larger nutrition agenda. We work with stakeholders and development partners in building an overarching strategy for integrating gender into the supply side intervention of food fortification. And this includes integrating, having a gender lens in program planning, implementation, capacity building, work plans, and monitoring and evaluation, and also communication and ICBCC. So we began with a stakeholder consultation, stakeholder mapping, just as the FHI team did. And our focus is very aligned with action area number 3, that is gender equality and empowering women and girls. So we did gender stakeholder mapping stakeholder consultation, and followed by a comprehensive gender analysis to understand the differences in constraints and opportunities available to individuals and groups of different gender identities, and also men and women. And this gender analysis was like the starting point for us to design a program intervention related to integrating gender into the larger food fortification program. I'll stop here.
Sure. I'm gonna come back and ask you a little bit more about how exactly you do this gender analysis, Rodi. But let me just go back to Juan. I mean, Juan, the world, it's 2023. We're facing challenges with post-COVID issues. We've got climate change. We've got conflict. We've got the higher increased cost of goods. Is that going to be stifling your work, Juan? And we've got one sort of concern here in one of the comments about the worry about time frame and how long it'll take for us to get somewhere with this agenda. Over to you, Juan.
Yeah, thank you so much for that. I think that yes, the challenge is monumental, and it's unlikely that we will see a change immediately at a large scale as we need it. It takes effort. It takes time. Social norms are not as giving food in the case of an emergency or in a social protection program. May address poverty, but you need to address the underlying causes and drivers of these inequalities. So, but I do think that we are seeing a monumental effort that recognizes multisectoriality, that recognizes the need for mobilizing not just change at the program and at the grassroots level, but in the narratives that we're giving down there. And what we're doing with this action agenda is really having that evidence of how change happens on a large scale and not just small, and how can we capitalize that for that. I think that one of the things I can just tell you, sometimes with very little pilots, you're able to see major change. And if, for example, WFP in Ecuador did a very simple study called the Fill the Nutrient Gap and the Cost of the Diet, to look at the cost of getting the nutritious needs covered by a family of 5. And what it did is that it realized that the adolescent girls require approximately 40% of the total cost of that household. And then particularly, they realized and revealed that teenage pregnancy was very high in Ecuador, with 55,000 teenage mothers. 10,000 of them were aged between 10 to 14, and the nutritional needs were huge. So based on these findings, just the finding of a single study, WFP with the government and the Ministry of Economic and Social Inclusion, with UNFPA and others, piloted a multi-sectoral intervention that aimed to fill a gap, a policy gap, that was able to highlight the specific needs, as I said, the nutritional needs and the risks that age and gender brought, and the kind of absence and invisibilization that these groups had. In that way, there was a program, a social protection program, in the context of this crisis, of this inflation, as you mentioned, that would give an extra amount of money to adolescent girls that were pregnant under 19 years of age in rural areas, so that those needs were better. And in fact, we saw improved dietary diversity increased in 70% among 60% of the recipients during pregnancy. And in that way, we were able to break the intergenerational transmission. Hundreds of children that wouldn't suffer from stunting. So you see, very little things can have major impacts in context of the complexity that we mentioned at the beginning. So I have full faith that we together are able to move this agenda forward at a bigger scale than what we've seen already.
Yeah.
Over.
Thank you. Sunday, you've spoken a lot about the multi-sectoral approach, and that's one of the action agendas. How do you delegate tasks, Sunday, and where does the buck stop?
All right, thanks so much, Mira. In delegating tasks, I think when it comes to the issues of women and girls, the government, I would have the buck stops at the table of uh, industries or sectors saddled with the responsibility of implementing interventions that would reduce malnutrition and improve the nutritional status of women and girls in the country. And if you look at the Nigerian setup, you have the federal, the state, and the local government, each and every one of those having one role or the other to play in improving nutrition and reducing malnutrition. Yeah, so I would say in line with the strategies that have been developed, policies in the country that have been developed, people started with the primary leaders in promoting nutrition is the government. I know that CSOs, donor agencies, and the rest of them will have a role to play, but mostly our roles are supportive roles to the government, because for there to be sustainable development, sustained intervention to reduce malnutrition, it's the primary role of the government. It's saddled in the constitution of the country, rights to food and rights to health and the rest of them. So the buck stops at their table. They have to make those decisions, and that's why we keep engaging to see to it that they are committed to implementing these policies, these strategies that I would say in Nigeria we have most of them already developed. And it's not just having them, but also seeing this commitment to get these interventions implemented by ensuring that on an annual basis fundings are provided for in the national budget and released as at when due. And when these things are being planned, interventions are being planned, we are engaging to see to it that this budget item speaks specifically to strategies, interventions that are focused on promoting optimal nutrition among women and girls and other vulnerable groups in the country. And so we mostly our advocacy, we do things like pre-budget meetings. The essence of engaging this government stakeholders in pre-budget meetings is to see to it that in the strategy, interventions that will promote women and girls nutrition are captured and in their budgeting. Because if you look at part of what we did was a policy gap analysis. And if you look at the policy, you look at the strategy that is supposed to operationalize these policies, you'll find that interventions that are supposed to speak to promoting this optimal nutrition, they are missing in the operational plans. And that what that means is that even though it's in the policy, there's no money to implement these actions that will bring the needed change, that will bridge the gap that we're looking at. And so the buck stops at the government table. CSOs, donor agencies are supporting the government, but we must continue in line with the action agenda, keep holding government accountable to play this role that they are called to play.
Yeah, so it's not just about changing policy. You got to think about the implementation and seeing it through as well. Good point, Sunday. Coming back to Rudy, I mean, you part of the program that you advocate for, large-scale food fortification. It's gender mainstreaming across the programs, right? And that's comprehensive. It includes gender analysis, gender integrated work plan, capacity building on gender related indicators. How do you conduct this gender analysis? Could you just be a little bit more specific so we can understand the toolkits that you use, the aspects that you cover, and where the participants can actually find them?
Right. Thank you for that question, Mira. I'd like to, before I go into the gender analysis framework and the methods we followed, I just wanted to make a point here that in India, there's the policy environment currently is quite enabling, because the National Food Security Act, for instance, talk about gender intersectionality. There's a huge appetite among partners and stakeholders to integrate gender and recognizing gender as a critical component of achieving equitable distribution of food and consumption. And at the end of the day, to reach everyone and no one is left behind. The issue comes where the how to aspect is something that everyone is challenged with. How to integrate gender? How do we approach gender in our existing programs, activities, and strategies? This is where we come in. So when we conducted a gender analysis, there are multiple frameworks across the board, wonderful ones. But we looked at, since it was also a familiar framework that we have used in other projects, gender analysis and gender integration is an integral part of every projects and programs and gender health supports. So when we conducted this study, we used the gender use and social inclusion framework. And this is a framework available online and developed by Gender Health, and adapting from many evidences and tools that are available not only in India but globally. And the framework looks at 4 critical components: practices, roles, and participation. This is about division of labor, who takes decision. Then we also looked at assets and resources, who has access to and control over resources. Knowledge, beliefs, perceptions, discover social norms. What is the level of awareness among different genders or sex? Then also legal rights and status. And the gender analysis was also informed by risk assessment matrix. We call it RAM. And we customize, we have a RAM tool, a RAM questionnaire as a part of our GYSI framework, Gender, Youth and Social Inclusion. And this is customizable and this is transferable across multiple contexts and multiple programs. And all you have to do is, in view of your context, you have to make necessary customization. So we use risk assessment matrix to interact with stakeholders, and which the risk assessment matrix have, again, critical components like safety, confidentiality, non-discrimination, respect, and community feedback mechanism. And these elements are looked at from the organization point of view and also from the community. Safety of project staff, researchers, and so on, and also safety, confidentiality, non-discrimination of the community that we intend to serve or we serve. And again, once the risk assessment was done, we also did a do no harm framework. So comprehensively, these are the critical elements that we use to conduct gender analysis. As I mentioned, you'll find many tools in different platforms. But to guide our gender analysis, we largely depended on the GYSI framework that Engender has. And the gender analysis was informed by a literature review, evidence review of the gender dynamics, power relations, and structural issues that are there in nutrition program, not just LSFF. And also we conducted qualitative interviews with different stakeholders, right from the national level, government, technical partners, the food industry, state level stakeholders, and also the community, and particularly women and adolescents.
Okay, I'll come back to you, Rodi, and go through the importance of data and how it just sounds so data heavy, and what sort of assistance you actually need in terms of data to inform decisions. But just coming back to Juan, I mean, Juan, and building on what Sunday actually spoke about, how do you get governments to buy in? How do you guide governments to decide a program? And most importantly, Juan, what's been your experience when it comes to implementations? What have been your observations?
Thank you. In fact, how do you make sure that governments come to the table and really buy into this agenda? I think the quintessential question. First of all, I could say that you could bring evidence, and I think that evidence is the most important element that we can bring to the table to really showcase the impact that neglecting gender, nutrition aspects, and their interface have for their populations, and not just for women and girls specifically, but all of society, men and boys as well, which is another of the questions that we have in the chat, which I'm very glad to see as well. But what happens when you have evidence and you find yourself against the wall with ideology, which is often the case, when governments have very deeply defined ideas of what gender is and should not be within their societies, which I've unfortunately encountered more often than I would have wanted. And it's where you come to realize that you need to take an incentive compatibility approach, an approach in which you, by acknowledging the gender ideas, the norms, the priorities that they have, that there is a chance that by bringing a gender lens, you're able, in social protection programs, you're able to showcase the value and the impact of this. So, for example, I see in a lot of negotiations with governments that they say the investment should not be in social protection or in providing nutritious foods for specific groups of the population, particularly in the 1,000 days. Investments into poverty reduction we've seen are greater when we invest in infrastructure, which is often gender blind. So then you start to understand, to explain to people, and we've often done this with governments, to say, it's fine, you can invest in infrastructure. It's like a phone, great hardware, but the importance of the infrastructure, of the asset that you have, is that you won't have the software. Otherwise, this is going to be a very expensive paper holder. So how do you create the case into explaining that you also need to make that investment, that one thing comes together and that they can be complementary? And why is it that particularly in the 1,000 days, it is critical to bring women and men, but in particular women as caregivers, as the ones that would have to deal with the biological consequences of having a kid and that will need the nutritional requirements. So you take, unfortunately, a gender instrumental lens, but design a program that is transformative in nature by bringing men to take their fair and due share of the responsibility and challenge the instrumentalization of women that we've often seen in programs. So it comes with the design, it comes with the incentive compatibility, it comes with the evidence, but the understanding that ideology would often come to block you, and that you need to play around it, and in building a narrative that really advances everyone's agendas.
Sandy, I'm going to come back to you about including men as a stakeholder. What's been your experience and how?
Yeah, come again, please. I didn't get you.
Can I ask what's been your experience including men as a stakeholder in championing or closing this gap?
Okay, thanks so much. I think it's a game changer. Let me start from there. It's a game changer in the sense that when men come to an understanding or an informed position that the woman is not seeking empowerment in order to become an authoritarian or take his place in his home, but rather the woman is seeking to be empowered in order to fulfill his or her potential, in order to achieve her best self, so she can both contribute to her own life and also to contribute to the well-being of our family. And from experience, we've learned that involving the male folk in programs, activities that relates to bridging this gap has helped to open so many doors to demystify most of the myths that you have in most communities. We've had instances where gatekeepers and traditional leaders now decide to, on their own, take the lead in educating their community members the importance of the girl child education, of the girl child not just stopping at maybe the basic education, but aspiring to the highest level of education, because that woman will be empowered to achieve her God-given potential, be a blessing to her family and also to the society. I see comments around also involving, the vulnerable men and girls. The truth is, the reason why we keep hammering on the women and girls is because naturally, in most homes, for example, in Nigeria, you find out that the male child from the word go from birth already has, how would I put it, that privilege, that opportunity of going to school as much as he or she wants to go to, has access to, for example, land, if he wants to go into agriculture and the rest of the things. But most of the women and girls in most communities don't have these privileges from the word go. And so, yes, we're speaking for women and girls because for a very long time, they've been denied access to, what ordinarily should be theirs from the word go. And the truth is that the male folk has a role to play. They need to understand that women are not a threat. They are actually companions. They are supposed to be support to their families and to themselves. And just as the boy child has opportunity of aspiring to become the president of the country, of becoming a professor or whatever, every girl child should also aspire to become what he or she wants to become. And this can only be attained if, for example, they have access to the best of education, they have the opportunity to aspire to the highest level of decision making in the country. I gave instances in the webinar one, where, for example, in the Senate of Nigeria, where you have over 109 senators, you have less than 5 women in that kind of important institution that makes laws, policies, that guides the country. That's not acceptable. It needs to change. And it's only when we educate the male folk to support this process that it can actually happen. So they need education, they need information, they need to know that the women folk are not a threat, but rather they just want to become what God meant them to become, their best selves, so that they can, help their families, help themselves, and also attain the best possible, the highest, position or education they want for themselves. Over.
Well said, Sunday. I don't know anyone else would have said it better than you did. Coming back to Rodi, Rodi, just gonna last question from you. Juan spoke about gender biasness and even infrastructure. You use data and evidence to mainstream gender in large-scale food fortification. How do you ensure there's a less bias or there is, lesser bias compared to, you would otherwise?
Right. Yes, that's a very good question, and this can have many responses. So one aspect is how can you reduce biases, prejudices, particularly being gender blind, gender neutral in programming. It's extremely important to engage community at the outset. Community engagement in not only program design, but also in designing your activities. For instance, if you're designing communication strategies, please engage the community and how they understand things, what are their priorities. And when you design them, for example, we talked about male engagement. When we started this project, we reviewed the communication materials and found that though they are very well intentioned, but the focus was highly on women and women seen as caregivers, women seen as providing food to the family, and so on. And so unintentionally, we reinforce gender stereotypes. So it's extremely important to also, in addition to engaging with the community and understanding their context, their needs, their requirements, their aspirations, but also at the programmatic level in designing training, communication. It's very important to wear a gender lens and understand that our activities do not promote gender biases, prejudice. The other way of minimizing or addressing potential gender bias is also including gender as a part of the measurements and monitoring indicators, and understanding how equally or the project interventions are benefiting the community, and in terms of gender indicators, not only in routine monitoring M&E, but also surveys, questionnaires, and research. It's extremely important to capture the perspective, the experiences of the community, both from men and women and adolescent girls and other vulnerable communities, including gender minorities. So, and looking at different aspects of, in our case, we look at supply chain. So we look at workplace, we look at communication, we look at capacity building, we look at monitoring and evaluation. And in terms of workplace, it's important to look at, working hours, infrastructure, safety, whether we have different toilets for men and women, other working hours acceptable to women and men and other vulnerable groups, and do workers know about the existence of policies regarding prevention of sexual abuse and things like that. So
Okay.
Yeah, I'll stop here now.
Okay, we're running out of time, unfortunately. I can go on talking to the three of you for a very long time, but we've already gone past the time. Now, at the beginning, I spoke about the action agenda and how it's a vehicle for change, for providing the means to advance priorities with policymakers and decision makers to ensure actualized outcomes. What would you like to leave us with, Juan? I'm going to start with you. Would you have a message for us? Juan, are you there?
Yes, sorry, internet
okay.
connectivity. So a key message is that we can achieve this closing the gender nutrition gap at scale if we work in a multi-sectoral way that entails taking challenging narratives, and deeply rooted ideas about women and girls. So thanks a lot for the opportunity of being here with all of you.
Sunday, your message?
Yeah, for me, I think bridging the gender nutrition gap is actually the path to the future for any nation or any country. Like the saying goes, if you build up the woman, you're actually building up her community or her nation. And so we need to invest in transforming the lives of our women and girls, because they hold the key to a beautiful future for every nation and every country. So let's do it together. Let's run with the gender nutrition gap campaign in our countries, in our states, wherever we find ourselves, because it's the right thing to do, and now is the time to do it. Over, please.
Thank you, Sunday. And Rodi, your message?
Yes, let's make gender integral to all our programming and our interventions and our dialogues. And again, use evidence to communicate your ask, and be very specific about who and at what level, what are those resources that you'd like to bring in for women and girls to advance.
Thank you all. Thank you all for joining us. Juan Gonzalo, Social Protection Program and Policy Officer at World Food Programme. Sunday Okoronkwo, Executive Secretary at Civil Society Scaling Up Nutrition in Nigeria. And Rodi Gangte from Engender Health in India. Ladies and gentlemen, international and collaboration and cooperation are key if we intend to put into action these areas outlined in the Gender Nutrition Report. And so I have the pleasure to invite Dr. Paul Zombrano, Acting Regional Director of Alive and Thrive East Asia Pacific, FHI 360, for his closing remarks. Paul?
Thank you, Mira, and thank you, everyone. I appreciate that you're all staying with us, even if we're a bit over time. So I'll try to be very brief. So thank you to all of you for joining us in this webinar series. Through our passionate and our engaging speakers, we did not only learn about the critical issue of the gender nutrition gap and its drivers, but we also learned more about what can be done with just a few examples. I'm sure many more will come in the time ahead that shows concrete advocacy actions already taken with the guidance of the action agenda. So this agenda, as mentioned several times, it was developed and co-created and backed by over 40 organizations globally. But we hope that in time, many more will contribute to this collective effort in the different countries, different regions, and of course, globally. With that said, we are confident that this webinar is just one of the excuse me, it's the beginning of a series of impactful actions and meaningful partnerships. Looking ahead, we are excited to announce a follow-up learning visit to Vietnam this coming January. In this visit, 15 participants from the Sun Civil Society Network will be hosted in Vietnam, and we are aiming for this visit to provide valuable insights and to inform concrete actions for adapting or replicating successful models and interventions for closing the gender nutrition gap. As mentioned by our colleagues and through the efforts of our coalition members, we will be taking this advocacy to other platforms such as Nutrition for Growth. And we, of course, look forward to how all of you will help sustain the momentum on this advocacy and how we can work together even more. While we are excited for these next steps, our progress to date would not be possible without the generous support of the Swiss Agency for Development and Cooperation, or SDC, and the Government of Ireland. A heartfelt thanks also goes out to the Women's Nutrition Team at FHI 360 and Save the Children UK, the coordinators of the Sun Civil Society Network. Their unwavering support is very much appreciated. So let's all keep working together, but more importantly, let's bring others along to help close the gender nutrition gap. On behalf of the organizers, many thanks for joining us. Keep safe, everyone.
Thank you very much, Paul. And with that, we come to the end of the webinar series, Closing the Gender Nutrition Gap, an action agenda for women and girls. On behalf of the organizers, I'd like to reiterate that we'd like to have you as part of the community of practice, as part of our efforts to close the gender nutrition gap. Some of the materials and links from the webinar, as well as the follow-up form, will be shared with you after this webinar. We look forward to working with all of you. Thank you for joining us.